Welcome. The people you see behind me are professional actors. They're about to portray nursing home residents, doctors, and nurses in some of the most common situations related to the topic of agitation. As many of you know, these situations in which older persons are either becoming agitated or are already agitated can be frustrating, time-consuming, and even dangerous to them and those who care for them. You are also about to see possible solutions. There are three guiding principles when trying to manage these situations: anticipate, tolerate, and don't agitate. Anticipate. Certain behaviors and actions are common, not normal, but common among nursing home residents with dementia. Being able to anticipate these behaviors and actions may help you avoid an episode of agitation. Tolerate. This one's tough, but if we can tolerate behaviors and actions that are not normal, this may allow us to remain calm and help our resident remain calm. When we tolerate behaviors, it also allows us to observe some of these behaviors that may give us clues as to what is causing the agitation. Don't agitate. Perhaps the most difficult of the three principles. In healthcare, we've learned standards and norms that may not always apply to the older person with dementia. For example, reorientation may not always help a confused older person. It may be better to try and understand what the resident is perceiving in their world. For perception is their reality. This may help lessen the agitation. Finally, when trying to implement any of these three principles for a given situation, keep in mind, finding solutions often involves creativity, trial and error, and a lot of patience. It's lunchtime in the nursing home. Mrs. Williams, who is in the background pacing, has lived here for over a year. Mrs. Johnson, who is sitting at this table, has only lived here a week.
My lunch.
No, this isn't.
My lunch.
No, this is my lunch.
I want to eat lunch. My lunch.
Don't touch me. Go get your own lunch.
My lunch.
What do you want, Mrs. Williams?
My lunch. My lunch.
This is her lunch.
Help me. My lunch. Help me.
I'll get your lunch. Just wait here.
Don't touch me. I want to eat now.
I'll get your lunch. What would you like?
Let's stop and analyze the situation. What's the problem? Is Mrs. Williams the problem? Is this one of those behavioral problems? Is she anxious? Is she depressed? Does she have a UTI? The answer is probably something quite different. What does she mean when she says my lunch? My lunch place. Remember, she's lived here for over a year. Routine is very important to her. If the nurse had remembered this, she might have been able to diffuse the situation. Let's see if this works.
Hello, Mrs. Williams. Are you ready for lunch?
Hungry. My lunch. Time to eat lunch.
Mrs. Johnson, this is Mrs. Williams. Could I ask you to move over to this chair?
I'm sitting here.
Well, I know. If I could ask you to move over to this chair, it'll be your chair.
Well, I sat here first.
I know that this chair is Mrs. Williams. It's very important to her. This chair, if you will, be yours. And Mrs. Williams can sit in hers, and we can all have lunch.
My lunch.
I'll get you lunch.
That was a good solution, and the nurse did a good job of anticipating a potential problem, but not everybody was happy at the end. Let's look at the same vignette with yet one more possible solution.
Hello, Mrs. Williams. Are you ready for lunch?
Hungry. Time for lunch.
Mrs. Johnson, this is Mrs. Williams. Mrs. Williams has been with us for over a year. You two are going to have lunch together today.
My lunch.
I'll get your lunch.
The solution in the last vignette took a proactive nurse. She also used creativity and anticipation. Did you notice as she introduced each resident to each other that she slid the lunch tray to the other seat? There are many solutions to a situation like this. The key here was creative anticipation. The next 3 vignettes are about Mr. Jackson. Mr. Jackson is only 72 years old, but he has early onset Alzheimer's. He has been in 3 nursing homes in the past 3 months. Let's see why.
Hello, Mr. Jackson. You ready for a nice lunch today?
Lunch? Yes.
Oh, Mr. Jackson! Mr. Jackson! Oh, what a mess. Bob, will you help me, please? Mr. Jackson, can you stop?
Mr. Jackson, look, you can't do this here in public, okay? You just can't do it. You can't pee in a plant, okay? Please.
No.
Let's go.
No, lunch.
Yes, of course. Let's go.
How could we have handled the first situation? Why was Mr. Jackson more agitated? Was there a way to tolerate his behavior? Let's see.
Hello, Mr. Jackson. Ready for a nice lunch today?
Lunch, yes.
Mr. Jackson? Hey, let me help you out here, okay? Bob, can you take Mr. Jackson back to his room, please?
Sure. Mr. Jackson, come with me.
Lunch.
We'll be right back. We'll be right back.
So in the second vignette, we saw the solution was calm toleration. Now let's see the nurse use anticipation.
Hello, Mr. Jackson. You ready for a nice lunch today?
Lunch, yes.
Mr. Jackson, are you ready for lunch? Bob, Mr. Jackson is ready for lunch. Would you help him, please?
Absolutely. Mr. Jackson, come with me.
Nurse Bob reacted in this first vignette like many of us might. He got angry. However, in the second and third vignette, he stays calm. He also kept his language calm and simple. He did not try to get Mr. Jackson to stop the behavior or teach him that it was wrong. Remember, Mr. Jackson has dementia at a stage that probably prevents him from understanding this. Lastly, it is important to ask the question, why is Mr. Jackson doing this? Well, he probably can't tell us, but if we were to get into his world, his reality, we would probably realize that he couldn't find the bathroom and he couldn't ask anyone where it was. We also might realize that, as we know patients with dementia have visual spatial defects, he saw the round planter as a toilet. So, keep in mind the basic principles. Tolerate, anticipate, and don't agitate. What happens when a resident in a nursing home wants to go home? Our main character in this scenario is Mrs. Owens. She's 84 years old and has Alzheimer's dementia. Her daughter recently moved her to this nursing home. The setting is this. It's early evening. There happens to be a doctor at the nurse's station, but the doctor is not Mrs. Owens' doctor. Let's see what happens when Miss Owens arrives at the nurse's station.
Can you help me?
What is it?
I want to go home.
You want to go home?
Yes, I don't like this hospital. I want to go home.
Well, you can't. And this isn't a hospital.
Oh, you don't fool me. I'm not sick anyway. Why am I in the hospital?
And this is a nursing home.
No, it's not. I want to call my daughter.
Of course. What's her number?
What?
Her number, ma'am. Your daughter. What's her number?
It's why can't I go home?
Tell you what. You give me that number, and I'll call your daughter.
Before we get to a possible solution for this situation, let's just focus on the agitation. What was agitating Mrs. Owens? Before you say, well, it was just the mood of the doctor and the nurse, let's look at one thing that the doctor did and the nurse did. First, the doctor, something all of us have learned, reorientation. If you reorient someone and it doesn't work, don't keep doing it. The nurse, what did he do? He asked her a simple question, what's your daughter's phone number? Without knowing it, he probably challenged her by asking that short-term memory question. So let's look at the scenario again, where the doctor and the nurse, their mood might not change, but how they approach the situation, they're getting one step closer to Mrs. Owens' perception of what's going on.
I don't like this hospital.
Of course you don't, ma'am. Nobody likes being in the hospital.
That's right. I want to call my daughter.
Okay, you can do that.
My daughter, I must talk to her.
Her name's Jane, right?
Yes, Jane. That's my daughter.
Okay, I'll get her number for you. Come on over. Here we go. Hello, Jane. Yeah, this is the nurse that takes care of your mom. As you know, she doesn't really like being in the hospital. She was wondering if she could talk to you. She really wants to come home. Okay, here she is.
Hi, Jane. I want to come home. I don't like this hospital. Oh, you can't come get me? Well, why not? Oh, the doctor thinks I should stay. Well, why? I'm not sick. Well, I guess I am feeling a little better. Oh, you can? You can come get me tomorrow? Okay. Well, I guess I'll see you tomorrow.
Although this type of creativity might seem like you're tricking the resident, let's look at it from a different perspective. Trying to understand where your resident is and what their perception of the situation is may help you meet that person in their world at that moment. Remember, Mrs. Owens' perception that she's in the hospital is her reality. Anything that might refute that may not only be scary to her, but it could cause agitation. On the other hand, trying to get a little bit into her reality, whether it's with words, mood, or action, could help you find the solution you need for that certain situation. Let's see this time how our doctor and nurse perform.
I don't like this hospital.
Of course you don't, dear. No one likes to be in the hospital.
That's right. I want to go home.
I'm afraid I don't know you, ma'am.
I don't like this hospital. I want to go home.
I understand, ma'am. What's your name?
I'm Barbara Owens.
Well, Mrs. Owens, I'm Dr. Simmons. How have you been feeling?
Okay, I guess.
Well, how about we just take a look and make sure everything's okay, all right?
Okay.
Well, everything sounds okay.
Okay, but I still want to go home.
I understand.
I want to see my grandchildren.
I understand. Tell you what, let me see if I can help you out. How about we get your nurse?
Okay.
Mrs. Owens, I hear you're feeling a lot better. And I'm very proud of you, you know that? Your therapy's going really well. I have an idea. Why don't we go for a walk?
A walk?
You want to do that?
Yes.
Good deal. You know what we can do? We can take a look at that photo album of yours that you like so much with all your family in there. And if I'm not mistaken, you're a grandmother, aren't you?
Yes, my picture.
The doctor and nurse in this last vignette demonstrate some good techniques that might be useful in some similar situations. For example, the doctor starts out by asking Mrs. Owens what her name is. This diffuses the agitation right off the bat. Then the doctor came around the nurse's station to interact with her face-to-face. And she used the doctor's secret weapon for calming patients, the stethoscope, while offering to help. Notice, all this took the doctor less than a minute. The nurse? He was calm and positive, but not so positive as to increase Mrs. Owens' distress. Finally, he changes the subject to take her mind off the reason for her distress. Now, not every technique will work in every situation. For example, the stethoscope. It can frighten an agitated patient if they don't understand what it is. Keep in mind, we are showing you some of these techniques to help you develop your own creative techniques so you can help your patient in these situations. In this situation, our resident is Mrs. Mahoney. Mrs. Mahoney has lived in the nursing home for 3 years ever since her stroke. It's important to know that Mrs. Mahoney's stroke was in the right side of her brain, which affects the left side of her body. On any given day, Mrs. Mahoney likes to go to the nurse's desk after breakfast to talk with the nurses. However, today, the nurse is quite busy. Let's see what happens.
Hello, Gail. Hello, Gail. Have you seen my daughter?
Hello, Mrs. Mahoney. I'm rather busy right now.
Gail, my daughter, I don't know where she is. Have you seen her?
No, I don't know where she's at. I'm sorry.
Gail, have you seen my daughter? I don't know where she is.
Hello, Mrs. Mahoney.
Oh!
Why don't you come with me and we'll go back to your room, okay?
Why?
I'm just trying to help.
I'm okay. I'm okay.
So what went wrong here? Remember, Mrs. Mahoney's had a stroke on the right side of her brain, which not only affects the left side of her body, but affects her visual fields. She has what's called a left-sided neglect. She has a blind side. The nurse approached her from her blind side. No wonder she's startled. Let's see how we could have done it.
Gail, do you know where my daughter is? I've been looking everywhere. I can't find her.
Oh, I sure don't. Alice, could you help me over here?
I can help you, Mrs. Mahoney.
Oh, that's sweet, dear. Do you know where my daughter is?
I don't, but I can sure try to help.
I've been looking everywhere for her. I can't find her.
A few final points. Did you notice how the nurse, the busy nurse, maintained her calm while trying to bring Alice around to Miss Mahoney's right side? And Alice, did you notice how few words Alice used? Did you notice how Alice approached Miss Mahoney and had her attention before she spoke with her? And when Miss Mahoney asks again, "Where's my daughter?" Alice gives an honest but hopeful answer. "I don't know, but I can sure try to help." Mr. Sherman is 82 years old. On any given day, his mood can fluctuate between happy-go-lucky and angry and demanding. Recently, he's been fixated on calling his daughter every day. The situation today, though, is a little bit more challenging because when he approaches the nurse's station, he's already agitated.
Good morning, Mr. Sherman.
I want to call my daughter.
I don't think that would be such a good idea. I don't think your daughter wants you to call every day.
I want to talk to my daughter. Give me the phone.
I can't let you use this phone.
Give me the phone.
No,
I want to talk to my daughter. She needs to hear from me.
I'm sorry, Mr. Sherman, I'm really busy. And I'm sure your daughter understands that you're being well taken care of, and I'm sure she'll call you in a few days.
Now. I want to talk to my daughter now.
Do you blame this nurse for being upset? It would take a very patient nurse to tolerate this behavior and come up with a solution to keep Mr. Sherman calm. Let's see.
I want to call my daughter. I want to call my daughter now.
Okay, here you go, Mr. Sherman. You can use this phone. Do you need some help?
Number. I don't remember.
Maybe this will help.
Yes. She wants to hear from me.
Alice, can you go get Mr. Sherman a snack?
Mr. Sherman, are you hungry? What do you say we come back to this a little later and we'll go get you a snack?
Snack?
Yeah.
Oh, okay.
Okay.
Although this situation turned out fine, a couple points to remember. In a solution like this, sometimes you're going to have to involve the daughter. The second point to remember is, even if something worked today, it may or may not work tomorrow. But don't be afraid to try new techniques, new creative ideas to find that solution you need.